Hi, I'm Dr. Jellybean Green, and I'd like to welcome you to Green's Academy of Spirituality and Metaphysics, or GASM. We are so grateful that you've agreed to be a test subject for one of our ongoing clinical studies. Today's clinical study will be focused on
sensory resurfacing.
Well, hey, thank you so much for joining us today for one of our clinical studies. The study we're working on today is on sensory resurfacing. Have you heard of it? Okay, well, either way, I'd like to start by getting you signed in. Then I'll have you sit down with me just right over here, and I'm going to give you a detailed explanation of what we're going to be going over today. Just the science behind the treatment, how it works, things like that. And then we'll move on to the treatment itself. How does that sound? Alright, great. So, just to make sure I have the right file here, can you please tell me your first name? Okay, perfect. I love that name. That's actually what I named my guinea pig when I was in 4th grade. Not really relevant, I guess, but if I reflexively offer you a little piece of celery or something, you'll know why. Okay, last name? Oh, okay. My guinea pig's last name was actually Guggenheim, but 1 out of 2 isn't bad. Okay, so I'm just going to read this over for you. Sensory resurfacing does involve a practitioner using various tools as well as their hands to gently touch the surface of a patient's body. Okay? If at any time, if at any time for any reason you feel uncomfortable, you are free to pause or stop the session. Alright? Now, it is common for patients to feel some very slight discomfort at moments as their attention moves to parts of their body that they may not have been fully present in for some time. However, the overall experience should be primarily pleasant, and we wish to emphasize that with sensory resurfacing, slow and gentle is best. Okay? Slow and gentle, best way to do it. Significant discomfort, whether physical, mental, or emotional, is actually counterproductive to the process, so please never push yourself past that point. Get to the consent here. Do you consent to your practitioner, that's me, using gentle physical contact as previously described, with the understanding that you are free to withdraw that consent at any time? Okay, thank you. Okay, perfect. Now let's go ahead and talk about how this works. If you will, you can just go ahead and sit right over here. Alright, so what is sensory resurfacing? Excellent question. So, sensory resurfacing is a holistic practice that gently resensitizes the surface of the skin with the goal of drawing one's consciousness from deep within the body back up to the surface of the skin. Alright? So, the idea with sensory resurfacing is that most of us are not fully inhabiting our bodies due to any type or series of stressors. We tend to recede deeper and deeper into ourselves, leaving our outer physical layers as a sort of protective barrier between ourselves and the world. rather than experiencing things directly and immediately, we numb out our outer layers so that experiences can filter through them before they register with us. That way, sensations or feelings which otherwise might be too overwhelming or too intense are sort of muffled or muted, and therefore they're easier to process, right? Okay. And that's not a bad thing. It's a survival strategy that our minds and bodies employ on a subconscious level to help protect us. Most of us will be in countless situations during our lives in which that is simply the safer and more sensible way to experience challenging things. However, the problem is that many of us tend to stay in that deeper, muffled, more protected place all of the time, even at times when there are no immediate stressors or challenges or, dangers around. Sensory resurfacing is a treatment that allows an individual to experiment with coming back to the surface of their bodies in a safe and controlled environment. The goal is not to pull you back to the surface and keep you there. That would be way too abrupt and intense, but simply to gently invite you to experience rising as close to the surface as you feel comfortable with. So that you can begin to practice doing it on your own in situations in which you know it's safe to do so. Okay? Once again, I'm going to repeat what I said earlier because it's so important. It is common for patients to feel some very slight discomfort at moments as their attention moves to parts of their body that they may not have been fully present in for some time. However, the overall experience should be primarily pleasant, and we wish to emphasize that with sensory resurfacing, slow and gentle is best. Significant discomfort, whether physical, mental, or emotional, is actually counterproductive to the process. So please, never push yourself past that point, all right? This includes both your experiences here in the treatment center and anytime you wish to practice on your own. Some people, bless their hearts, really want to give it their all and have a big breakthrough moment, so they push themselves. But unfortunately, that tends to cause a significant recoil effect, which ultimately makes the resurfacing process take longer and also makes it more difficult to sustain. When done correctly, the positive results of sensory resurfacing, they're so gradual and subtle that most people only notice what a difference it makes for them when they look back after weeks or sometimes even months of practicing it. Okay? So slow and gentle. Got it? Okay, good. Now, we have a variety of different sensory receptors throughout our body, but in this treatment, we will be focusing on engaging 4 of them. We have our Nociceptors, and I want to show you right away. This one makes people understandably nervous because the Nociceptors are the ones that register pain. So I want to assure you that we will not be doing anything to cause you pain, okay? I promise. We have tools that are too dull to puncture or otherwise harm the skin, but they're just pointed enough for the nociceptors to register them. It will feel much more like gentle, concentrated pressure than anything. Imagine the feeling of lightly pressing the tip of a pen against your skin, okay? However, while this is not painful at all, it is definitely the least soothing of the 4 treatments, so we do like to get this one out of the way first. Then we'll move on to interacting with your thermoreceptors. And your thermoreceptors are the ones that register heat or cold. We have 2 temperature-controlled containers here. One is a towel warmer that warms and steams hand towels. And we also have a refrigerated one that chills them, okay? So I'll be taking those and I will be placing those on your skin in a gentle and soothing manner to alternately register those cold and warm feelings in your thermoreceptors. The last 2 types of receptors we'll be activating with plain old physical touch, okay? So to activate your Piscinian corpuscles here, I will simply be using my thumbs, my fingertips, and or the heels of my hands to press into your skin with some gentle but firm pressure, okay? And your Piscinian corpuscles are the ones that register pressure. Make sense? Okay. Now, for your Meissner's corpuscles, and those are the ones that register touch, I'll again be using my fingertips, but this time, instead of using them to cause pressure, I'll just sort of gently trace them over the surface of your skin, just sort of gliding over it rather than pressing into it, okay? Now, for the first treatment, we stick with just the face and the upper extremities, so your face and head here, and your shoulders. But if you are interested in a full body treatment, leave a note for us in the comment box. It's not something we're currently doing a clinical study on, but we sometimes organize special clinics for treatments that patients are especially interested in returning for, all right? So that about covers it. If you'd like to join me back over in the treatment area, we'll go ahead and get started. Alright, so I'm just going to step right over here and grab my first tool. Not too many tools in this procedure, but here we go. Okay, so this little pick here is what we use to initiate or sort of wake up your nociceptors a little bit, okay? Again, I want to give you a nice look at it. It is just pointed enough to activate those nociceptors, but it will not cause any pain at all, just a little bit of pressure, okay? So, let's see. Okay, so again, we are just going to be working with the face and the upper extremities a little bit. So what I'm going to be doing is I'm going to be taking this, gently poking. I'm going to say poke each time I do it. It might be a little repetitive, but it's a sort of way to help you feel safer and more engaged by having that reinforcement of verbal notification of what's about to happen, okay, as it's happening. Alright, so I'm going to start just right over here on your cheeks. I'm just going to poke, poke, poke. Not bad, right? Okay, just going to poke, poke, poke. Feeling okay? Alright. I'm going to go across your forehead now. First in one direction, then the other one. Poke, 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 poke. Okay. Poke, poke, poke. Now we're going to go down your nose. Tip your nose one more time. Just there we go. How are you feeling? Ready for me to continue? Okay, I'm going to go down your jawline first on this side. Poke, 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 poke. Other side. Poke, poke, poke. Chin. Poke. Alright. And not too much more. We go real easy on this first session, like I told you. So just a few more across the cheek. And then I'll hit a few just random points, slowly and gently, okay? Okay, and here we go with the random ones. Poke, poke, poke. How's that? Alright, I'm going to get a few just on your upper arm here on the left side. Poke, 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 poke. Okay. Other side, upper arm. Just going to gently poke, 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 poke. How's that? Okay. Now we're all done with the nociceptor portion. Go ahead and place this over here. Okay, and first I'm going to grab this cool, damp, chilled towel. It's not super cold, but it's cool enough that you'll be able to feel it. And what I'm going to do is, again, I'm just going to very gently touch some different spots on your face and your upper arms, okay? Following a similar pattern to what we did before. Should feel nice and cool and soft and gentle, okay? Starting your cheek, we're going to go press, press, press. Other side, press, press, press. Nice and cool. Go across your forehead in both directions. Press, 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 press. Other side. Press, 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 press. Down your nose. Press, 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 press. Kind of nice, right? Okay. Get along your jawline. First on the left. Press, press, press. Jawline on your right. Press, press, press. Chin. Press. Okay. A few more in the cheeks, and then we'll do the random touches. Press, press, press. Press, press, press. There we go. Okay. Now a few random ones. Let me move it here to a cooler spot on the towel. Ready? So, press, 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 and press. do on your left arm, just the upper arm here. We're going to press, 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 press. Other side, just gently press, 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 and press. Okay. You want to take a nice deep breath. Your body is responding really well. I'm not sure if you can sense that, but I can see physically in the way people react that there are like little adjustments being made, even if they're really subtle, and you're taking to this treatment really well. I'm going to place this aside and grab a warm towel. Okay, here we go. And similarly, this one is really warm, nice, cozy warm. It's not hot though, so it shouldn't be uncomfortable. It'll just be a kind of nice, soothing warmth, okay? So again, starting on your cheeks, press, 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 press. Forehead, press, 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 press. Down your nose, breath, breath, breath. Jawline on the left, you're doing great. Press, press. Jawline on the other side, press, press, press. Chin, press. Good. Cheeks again. 1, 2, 3. 3, and then just a few random touches. 1, 2, press, press, press. Upper left arm, press, press, press. Upper right arm, press, 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 press. I'm going to throw this in the laundry over here. Alright, so we're already halfway done. Moving on to the last 2 types of receptors. Just going to be using plain, old, physical touch for this part, okay? So let me just take a couple quick notes here. So we're caught up. Okay. So yeah, to interact with Piscinian corpuscles, I'm going to be simply using my thumbs, my fingertips, to gently press in those same spots, okay? And that's the pressure receptor, okay? And then we'll go ahead and move on to the Meissner's corpuscles, and with those ones, it'll be similar. It's going to be pressure, but instead of pressing in, I'm going to be sort of gently tracing them like a swoop, I call it, over the surface of your skin, okay? So, starting with your cheeks, I'm going to use my fingertips to press, 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 across your forehead, press, 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 going the other direction, press, down your nose, just gonna press, 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 left jawline, press, 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 right side, press, press, press. You could give your chin a nice press, good. Cheeks again, press, 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 a few random spots. Press, 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 press. Good. Upper left arm, we're gonna press, 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 press. Other side, upper arm, we're gonna press, press, press. Beautiful. I'm gonna take a moment to take a breath. I'm just gonna take a quick note here. Let's see, okay. So moving on to the last step here. Do we have And I'll just go ahead and remind you now that this is just sort of like an intro treatment. We don't currently offer the full treatment, but we do have that comment box down there. If you would be interested in like a full body sensory resurfacing, like a more advanced level one, let us know. If we get enough interest, we might offer that. Okay? Alright, so let's go ahead and work with this Meissner's Corpuscles, and then we'll be all done, okay? I'm gonna glide, okay? Using my thumbs on this side, just glide, glide, glide. Now on the right, glide, glide, glide. Across your forehead, we're gonna glide, glide, glide. Other direction, glide, glide, glide. Beautiful. Actually going to do both sides of your jaw at the same time. Glide, glide, glide. Across your chin, glide. Down your nose, glide, 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 glide. Cheeks again, glide. Getting both of them at the same time. Left, glide, glide, right, glide, glide. A few random ones, glide, 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 glide. Beautiful. Arm, left side, gently gliding my fingers down, glide, glide, glide. Other side, we're gonna glide, glide, glide. Beautiful. Wow. You responded so well to this treatment. I'm so thankful that you came in. I do hope that you will come in for more of our clinical studies. And again, let me know, as if kind of like a side thing, if you'd be interested in a more in-depth sensory resurfacing treatment. I'm not sure if we'd be doing a clinical study on it or not. It might just be a service that we offer for some of our more frequent clients, okay? But that's up to you and whether or not you feel ready for it. Alright, well, thank you so much for coming in today. It was a pleasure working with you, and I hope I get to see you again soon.